Obsessive Compulsive Disorder, OCD. Obsessive Compulsive Disorder features a pattern of unwanted thoughts, fears, or obsessions that lead you to do repetitive behaviors or compulsions. These obsessions and compulsions interfere with one's daily activities and cause significant stress. You may try to ignore or stress to stop your obsessions, but that only increases your distress and anxiety. Ultimately, you feel driven to perform compulsive acts to try to ease your stress. Despite efforts to ignore or get rid of bothersome thoughts or urges, they keep coming back. This leads to more ritualistic behavior, hence the vicious cycle of OCD. OCD often centers around certain themes, for example, an excessive fear of getting contaminated by germs. To ease your contamination fears, you may compulsively wash your hands until they're sore or chapped. If you have OCD, you may be ashamed and embarrassed about the condition, but treatment can be effective. Obsessive compulsive disorder usually includes both obsessions and compulsions, but it's also possible to have only obsession symptoms or only compulsion symptoms. You may or may not realize that your obsessions and compulsions are excessive or unreasonable, but they take up a great deal of time and interfere with your daily routine and social, school, or work functioning. Obsession symptoms. OCD obsessions are repeated, persistent, and unwanted thoughts, urges, or images that are intrusive and cause distress or anxiety. You may try to ignore them or get rid of them by performing a compulsive behavior or ritual. These obsessions typically intrude when you're trying to think or do other things. Obsessions often have things to them, such as fear of contamination or dirt, doubting and having difficulty tolerating certainty, needing things orderly and symmetrical, aggressive or horrific thoughts about losing control and harming yourself or others, unwanted thoughts including aggression or sexual or religious objects and subjects. Examples of obsession signs and symptoms include fear of being contaminated by touching objects others have touched, doubts that you have locked the door or turned off the stove, intense stress when objects aren't orderly or facing a certain way, images of driving your car into a crowd of people, thoughts about shouting obscenities or acting inappropriately in public, unpleasant sexual images, avoidance of situations that can trigger obsessions, such as shaking hands. Compulsion symptoms. OCD compulsions are repetitive behaviors that you will feel driven to perform. These repetitive behaviors or mental acts are meant to reduce anxiety related to your obsessions or prevent something bad from happening. However, engaging in the compulsions brings no pleasure and may offer only a temporary relief from anxiety. You may make up rules or rituals to follow that help control your anxiety when you're having obsessive thoughts. These compulsions are excessive and often are not realistically related to the problem they are intended to fix. As with obsessions, compulsions typically have themes such as washing and cleaning, checking, counting, orderliness, following a strict routine, demanding reassurance. Examples of compulsion signs and symptoms include hand washing until your skin becomes raw, checking doors repeatedly to make sure they're locked, checking the stove repeatedly to make sure it's off, counting in certain patterns, silently repeating a prayer, word, or phrase, arranging your canned goods to face the same way. Severity varies. OCD usually begins in the teen or young adult years, but it can start in childhood. Symptoms usually begin gradually and tend to vary in severity throughout life. The types of obsessions and compulsions you experience can also change over time. According to Mayo Clinic research on March the 11th of 2020, symptoms generally worsen when you experience greater stress. OCD, usually considered a lifelong disorder, one can have mild to moderate symptoms or be so severe and time-consuming that it becomes disabling. To see a doctor. There's a difference between being a perfectionist, someone who requires flawless results or performance, for example, and having OCD. OCD thoughts aren't simply excessive worries about real problems in your life, or liking to have things clean or arranged in a specific way. If your obsessions and compulsions are affecting your quality of life, see your doctor or mental health professional. Risk factors. Factors that may increase the risk of developing or triggering obsessive compulsive disorder include family history, stressful life events. If you have experienced traumatic or stressful events, your risk may increase. This reaction may, for some reason, trigger the intrusive thoughts, rituals, and emotional distress characteristic of OCD. Other mental health disorders. OCD may be related to other mental health disorders such as anxiety disorders, depression, substance abuse, or tic disorders. Complications. Problems resulting from obsessive compulsive disorder may include, among others, excessive time spent engaging in ritualistic behaviors, health issues such as contact dermatitis from frequent hand washing, difficulty attending work, school, or social activities, troubled relationships, overall poor quality of life, suicidal thoughts and behavior. Prevention. There's no sure way to prevent obsessive compulsive disorder. However, getting treatment as soon as possible may help prevent OCD from worsening and disrupting activities and your daily routine.